Good evening, guys. This is Dr. Paul. Thank you very much once again this evening. I want to talk a few minutes about Pityriasis Rosea. We have so many papillosquamous disorders, varieties, psoriasis, Pityriasis rosea, tinea corporis, lichen planus, pityriasis, and lichenoids, dermatomyositis, lupus erythematosus, and sometimes even secondary syphilis. These are basically disorders we come across as papillosquamous disorders. And today I want to talk just about Pityriasis rosea. You see, there are two words we need to remember when we talk about this disease. Number one, herald patch, and number two, Christmas tree pattern. Herald patch, it comes like a solitary lesion. It's a oval shaped lesion like 10 centimeters in diameter, and it also has central clearing. You remember Lyme's disease where we have that rash with central clearing. Similarly, in this disease we have this oval lesion with a central clearing, and this lesion, it actually gives way like 1 or 2 weeks after this problem. We get a more generalized eruption called Christmas tree pattern. So those are the two specific words you must remember: herald patch and Christmas tree pattern. Now let us talk a few things like what are the most common age groups that get this disease. Most commonly this disease is seen in school children and adolescents, but you can say from 2 to 4 decades of life. And there is a big debate, but it's thought to be due to a virus, and commonly the human herpes virus 7. So human herpes virus 7 causing this papillosquamous eruption and resulting in this disease Pityriasis rosea. And it is like from 2 to 4 weeks. It affects all sexes. I mean, both men and women are equally affected by this problem. Now, herald patch, as I said, it is a solitary lesion and it is oval shaped and it has an erythematous border, whereas the Christmas tree pattern lesions have a scaly border. So that's the difference. And after the herald patch, we get the Christmas tree pattern. That sequence is also important. First it comes with herald patch and then it transforms into Christmas tree pattern. Now, let us see what are the most important things in the differential diagnosis. The most important thing is secondary syphilis, because secondary syphilis needs definitive treatment, whereas Pityriasis rosea is just a self-limiting condition. So whenever there is suspicion of secondary syphilis, you should do a VDRL test. And also the other thing is ringworm, tinea corporis. That is also often confused, especially with the herald patch. Let us talk finally about treatment. This is a self-limiting condition. Most of these lesions, they regress by themselves. However, patients can ask for symptomatic treatment. Like if the patient has itching, you can prescribe some antihistamines or hydrocortisone 1% cream. So overall, this is a self-limited condition, but you should educate the patient because sometimes the lesions come and go. So patients may worry what is happening. So you should educate the patient about this progression. Some lesions come, and as they regress, other lesions come. And you can also educate patient to expose themselves to natural light because that helps in the resolution of this rash. So that's basically about this disease, and 3% of patients will also have a recurrence of this problem. That's why it's important to educate the patient that many people worry whether they get it again and again, but only 3% develop this disease again and again. That's briefly about Pityriasis rosea. The two words you must remember are herald patch and Christmas tree pattern. Thank you very much. And those of you who are going to USMLE Step 2 Clinical Skills, I recommend this book, USMLE Smasher. I am listening from all over the world actually how helpful this book, and I recommend this book to you also, USMLE Smasher. And many of you are taking expensive courses like spending like $2,000, $3,000. That's not necessary. All you need to know are some tips that help you to pass this exam. And this book is extremely helpful. USMLE Smasher. So I encourage you to get this book. Thank you very much. Have a good night.